Welcome back, everyone. This is our Functional Health Podcast where we explore natural and holistic ways to support your health. My name is Ricky Trugalo and I'm your host today. And today's episode is actually following up with our last conversations, exploring this time how chiropractic care can actually help with hormone changes. So whether you're dealing with PCOS, PMS, pregnancy, postpartum stuff, or even if you go through menopause phase, those hormones ups and downs can feel like a roller coaster. So, but here's the thing, and this is something that I learned today. Your spine and your nervous system play a bigger role in this ride, much more than you think. So in this episode, we are going to chat about how chiropractic adjustments can help support your body natural balance, reduce your stress, and maybe even make this time of the month or that whole season of life a little bit more manageable. So joining me today is my co-host, Dr. Geeta Kianian. Hi, Dr. Geeta.
Hi, Ricky.
So Dr. Geeta, for those who don't know, she is a chiropractor who has been caring for families for over 2 decades. Her specialties includes also working with pregnant women. I was very surprised about that. She will talk about it. Also supporting women through a variety of hormone changes, whether it's during your cycle or pre and post menopause. So I do have many questions to you, Dr. Geeta. And so let's get started.
Let's go for it.
So let's start with can you really explain our audience? And I was very surprised when we talked about it before, how exactly the nervous system and the spine health are really related to hormones regulations in women.
If you look at it, the nervous system is the body's main network system, and it directly impacts the endocrine system, which is our hormonal system. So we get the nerve signals going to all the glands and different hormone producing organs that could be regulated by all the natural 100% nerve flow. Now, if this nerve flow or gets interrupted, if you have subluxation, which is misalignment or bone out of place in your spine, that interferes in sending the nerve signals to those organs that are producing hormones, namely thyroid, ovaries, your adrenal glands. They could not get the normal nerve signals that they used to get. So that interrupts the hormonal function and interferes with the hormone production. So it affects your hormonal balance.
Wow, that's amazing. So, and how exactly we can change the hormones in women, or I would say, what are the most hormonal changes in women that can be addressed through the chiropractic care?
So, there are different hormonal dysfunction that we see at different stages of women's life. When they start their menstruation cycle, a lot of times they go through PMS symptoms, which could be cramping or muscle spasm, mood swings, irritability. Then we have people who don't have regular periods or regular cycle, and that's irregular cycle that affects their fertility issues. That's why sometimes that could lead to having fertility challenges. Then we have pregnancy-related hormonal shift that happens. Then we have postpartum and going through postpartum period, people experience different shifts in their hormones. And then premenopause and menopause and postmenopause, all the hormonal shift that happens during these periods could be related to not getting the normal nerve signals to those hormone producing organs. So we could address that depending on what stage of life they are and what symptoms they're experiencing.
Oh, wow. That's fascinating. So, yeah, you mentioned PMS. There are so many young women who suffer from PMS. And in the past, we didn't even know that these things exist. We thought that there's girls that just been, they can, it's like today we know that, there is such a thing which is PMS. And my practice help to balance the hormones. But since we mentioned PMS, how exactly chiropractic adjustments can help with the symptoms related to PMS?
So most of the time, the cramping or muscle spasm that patients are experiencing during the PMS is could be helped by doing adjustments in their lower back and pelvic area. That helps to reduce the muscle tension and inflammation and cramping. Also, some girls experience symptoms like fatigue, tiredness, mood swings, and a lot of times that could be helped by realigning the neck area, because if that goes out of alignment, it could interfere with the signals that are sent to the brain, and you could have some of those symptoms. Those are the areas that we emphasize on and focus on when there's a PMS symptoms.
Yeah, wow. Yeah, I remember when I got my period, I used to get my period, I had low back pain. Yes. And, all the stress is locked in the certain areas. And I didn't even think, like, back in the days, we didn't even know chiropractic care. So it's very fascinating. So let's talk about pregnancy. I was under the impression that we shouldn't touch women during pregnancy. And I didn't even think to go to a chiropractor during pregnancy. I was very scared from that. And I know that many other women do. And I was very surprised that you actually work with women during pregnancy. And this is one of your expertise. So tell me more about like how exactly chiropractor care plays in managing hormones shifts during this phase.
When you're going through the pregnancy period, there are certain hormones that are producing a lot, and your body has to manage it, namely estrogen, progesterone, relaxin, and that shift drastically could affect having different symptoms of lower back pain or instability in the pelvic area. Also, the relaxin, these hormones that are produced during the pregnancy, are meant to have more flexibility in your joints and mobility. But at the same time, they could create problem because of the reason that your joints and your pelvic area are more flexible. So we concentrate on the pelvic and the lower back area during the pregnancy. And I know there are some of my colleagues who don't want to touch pregnant women, and that's understandable if they don't have the training. Usually the ones like me, we work on the pregnant women, so we already have all the means to help with the adjustments of the pregnant women. We have special tables that reduces the pressure on the belly, so there is no pressure on the fetus, and we have pregnancy pillows that we use, and we do specific adjustments that is geared towards helping the pregnant women. So, and also, you have to consider when a woman goes through pregnancy, they're carrying this extra weight that is pulling on their back and their pelvic area. So that by itself creates so much tension and pressure on the lower back. And also, if you look at women's posture, it starts to change, and they with shifting their posture and having more sway back or more curvature in the lower back, that puts even more pressure on the pelvic area. So all of those could be helped. I specifically do some myofascial release or muscle work, as well as adjustment to help with the muscle tension during the pregnancy.
Wow, that's fascinating. I didn't even know that there are special beds in your chairs, and so it makes so much sense now that you are telling that. Yeah, it's and I think it's very unique. Most chiropractors, like you say, don't work with women during pregnancy. And I know that for my pregnancy, I wish I could have someone that I can work with. Because yeah, the body change. The organs are moved. To different areas, and you have back pain, and you have like all your body is exhausted. So this is fascinating to know that chiropractic can support that. Absolutely.
Yes, and one of the other specialty technique that we use during the pregnancy, and we call it Webster technique, is especially geared for women who are carrying bridge position fetus. And what we use a specific technique to relax the ligaments that are so stretched, are so tight that prevent the fetus from movement. And also we do work on their sacrum, which is part of your tailbone, to help to get it in alignment so it's not obstructing the fetus movement. And it is very gentle technique, and it is very effective in turning the breech position to the normal position for delivery. I had over the years, I had a lot of patients who come in at the last resort because they've tried everything and the baby is not shifting. And after working on them and using the Webster technique, the baby shifts and they carry the baby normal delivery, normal labor, without having going through a C-section. There are ways to pregnant women. Unfortunately, not everybody is aware of it. As a matter of fact, I had a patient I remember a couple of years ago that she said that she tried everything to help the baby move and come to the right position. And the last technique they did is they do it in the medical offices and they do different maneuvers and that's the last result they do have. And the baby wasn't moving. So the nurse who was helping with that technique let everybody leave the room. And after everybody left, she told her, you should go and try Webster technique. And that's when she started searching, and then she came and saw me. And after a few sessions, the baby turned and she delivered the baby normal position. And she was so happy. So happy that she got pregnant with twins again.
Wow, that's amazing. That's an amazing story. Now, I remember my second child, she was in the wrong position, and I was like, and I was very narrow. And everybody told me, no, you cannot do that. You cannot do that. And then I went to a doctor, and I don't know exactly what he did there, probably chiropractic. And he changed the position. And like within 24 hours, I was in labor. And it was amazing. Yes, you remind me this story. So yeah, so let's talk about like after pregnancy. We deliver, and then the body is starting to slowly change back. Move back. All the organs are trying at least to move back. And I remember this time was like I had the worst back pain. I was tired, of course, all the time. I was nursing, so I was in pain all the time, and I want to learn how you with chiropractic care can help women during this phase.
So actually, when you're going through the postpartum, not only you're still trying, your body still tries to get back to the normal hormone levels, but you're still recovering. So what we do, we have to be careful and do gentle adjustments on the pelvic and lower back area. And at the same time, like I said before, working on the head and neck, because that pressure and that nerve signals, if it's altered, you don't have the right alignment and the nervous system is interfered with, then that's when people start having postpartum depression. There is too much going on. Their mental status is altered with the emotional stress. So these are all related. Like I always say, you cannot isolate your mental, emotional part from the physical part, from chemical or nutritional part. They're all connected. So of course, when you're going through these phases, like you said, someone like you with the knowledge of functional medicine and nutrition can help to supplement and help women to get the extra nutrients that they need. But at the same time, the physical stress has to be addressed by us working on their body and getting their spine in alignment and nervous system fully function, because like anything, healing happens from inside out. So you have to help the inside. Your body is 100%, so it could start doing the healing process. Yeah, for postpartum, we also concentrate on head, neck, and a lower back, sacrum area, and of course, mid back area that upper to mid back area that controls your adrenal glands. So we have to look at the whole spine.
Yeah, we have to look at the body as a whole. But how soon after labor, after giving birth, will you start working on the woman body?
So I have to say, have worked on women when they're pregnant until like a couple of hours before they have the baby delivered. I had a
Wow.
yeah, I had a patient. I just a couple of years ago that she came in. She was in a lot of pain and she wanted to have the baby sooner than later.
I'm familiar with that.
So I did adjustment on her, and I think right away her husband took her to the hospital and she had the baby. So it wasn't like it was right away on the same day. And at the same token, after baby is delivered, I always tell people it's up to you how your body is feeling, how you're feeling, and if you think that your body is okay to come in for adjustment, come in right away. If you feel like your body needs to have a rest, give it a rest. Because I always tell people that, if you tune into your body, you're the best doctor. You have to tune into your body and realize what your body is telling you. When we start listening to outside and we listen to everybody else or people telling us you should do this, you should do that, that's when everything messes up. You gotta
Yeah.
be more in tune, and you have to be in tune with your own body and realize what is going on. Uh, so I leave it up to people. But if you feel comfortable, I've had patients coming in the next day. I had patients who say, "Oh, I have to have rest for a couple of weeks before I come in." I said, "Yeah, it's up to you. You know the best. You know what your body needs."
No, yeah, it's like you say, we should be our doctors, we should be the ones who listen to our bodies. We should communicate with our bodies because our body communicates with us all the time. And when we stop communicating with our body, our body will stop communicating with us. It's like I see that with thirst. I mean, people say, I'm not thirsty. I never thirsty. And once I start to pushing them to drink more water, and they will start be thirsty. And then they say, "Oh my God, I can drink like two large bottle of water without even noticing, and I feel thirsty." Yeah, so it's like the body communication is the most important thing for healing. And yeah, I mean, every person is different. Like same thing with nutrients. Like some people come to me, some women after giving birth, they come to me and they ask me, how much do I need to eat? What can I do in order to lose weight? What can I do in order to get back to normal? And the really like the pace and the process is so different from one to another. So yeah, it's fascinating. So let's talk about perimenopause and postmenopause. This is where I am now, and I know that many women that I meet in my practice go through perimenopause and postmenopausal face symptoms like hot flashes, night sweats, even sleeping issues, mood swings that we never really thought that it's part of these hormonal changes. In my practice, I work with them through, of course, nutrition and also supplementations like herbs and stuff. But how exactly can you help these women during this phase?
So during the premenopause and menopause stages of life, if there is nervous system stress, if there's stress on the nervous system, it also affects the hormonal level like estrogen and cortisol that are known for the stress hormones. Cortisol contributes to the weight gaining and weight management. So part of the care during this period of life is making sure that there is no stress on your nervous system. So the nerves that are going to those reproductive system, there is no stress on them. So making sure everything is in alignment and the nerve flow is normal. And then a combination with the nutrition, with the supplementation, and lifestyle management, we could manage it. But you have to make sure there is no stress on the nervous system.
Yeah. Yeah, there is such a tight connection between our sex hormones like the estrogen, progesterone, testosterone, even with women with cortisol and other hormones like DHEA, which is like a kind of I can see it like as a master hormone that really helps with the receptors to collect the hormones. So it's amazing to know like see that even chiropractic, not even chiropractic care can help with that. So, and how this is all related, like how you can help with during that phase with the nervous system.
So, by reducing the stress on the nervous system, we help your body to relax. When there is a stress on the nervous system and you have misalignments, that activates the flight and fight response. By doing it and that's the sympathetic symptoms that happens. After doing adjustment, realigning the spine, we push the body to parasympathetic, which is rest and relaxation phase. And that helps to reduce the stress on nervous system. And that's part of the care for that stage of life.
Fascinated. And I know that we will move toward like the nutrition and supplementations. And so, how exactly do you, in your practice, what do you do in order to support beyond chiropractic care?
So usually what I do usually, first of all, I assess the nervous system and try to balance the nervous system, making sure there's no stress and alignment is in good conditions. And then we start addressing the nutritional aspect, like giving them questions and asking them in detail what is going on, what symptoms they're experiencing that they don't address when they come to see me. Because usually when people come to see a chiropractor, they don't think that they could help with the overall health. They just tell you about their muscle pain or ache. But we try to dig in and find out what are the other things that are bothering them by giving them questionnaires. And after assessing that, that's usually when I refer them to you to have them go through the functional medicine. I order some lab works as well, but I know that you do extensive lab works on these people, and you try to get to the bottom of the problem and find the root cause. Because most times when the lab tests are ordered by regular primary doctor, they don't do detailed lab works. A lot of times these women have to have more specific, more extensive lab work done to address the root cause of their problem, not just to cover up the symptoms, cover up what they come in with, like headaches or whatever. You want to go find out the root cause of the problem. So I think the lab work that you order and have them do extensive testing is part of figuring out what's going on, and part of the reason to figure out what supplementation is needed. Because like we said, not everybody fits the same textbook picture. Everybody is different, so you have to individualize it. So that's what we do. Also, after they get through, when we work on the spinal alignment and after their body is stable, we know that they're holding their adjustment better, we start implementing exercises and making sure that their spine is stable and doesn't keep going out of alignment, so they could maintain it throughout the life.
Yeah, of course. I mean, at the end of the day, we don't want people to be dependent.
Right.
We want people to be healthy, to be healthy, because the body can heal itself if we just give it an opportunity. I always say our body is strong. We can help it to heal itself. And I just want to share the audience with my experience with your intake. I came to you, and all the questions that you asked me, the X-ray that you did on me, like all the symptoms that you asked me, I didn't even think that a chiropractor should be care about. And you really like opened my mind in a way that, I should think about it, because I was sore in my back after I was on a motorcycle for a weekend. Like, okay, I need some adjustment. And this is why I came to you. But like when we talk, I learned that my neck is completely not aligned, and this is where we should focus on it. I didn't even think about it, but you also made me think of like my diet, my overall physical activity. It's like everything. So yeah, I mean, our intake is so comprehensive, and I've been in many other chiropractors cares. I know how to, like, I know to say, yeah, I mean, your intake was super comprehensive to others, so that was very fascinating. Yes, so that's bring me to my next question. It's like, how do you track? I know that we continue working together, and you continue to take care of me. But how do you track that, like the symptoms? How do you work with the person along the way, and we see the improvements?
So part of it, assessment and tracking, is making sure the symptoms are going away, but not necessarily symptoms going away means that you're completely healed, or your body is 100%. We also do functional testing, postural examination, and doing some ranges of motion, neurological testing, orthopedic testing, to make sure that your progress is really good. And then also, if the lab work has to be repeated, if x-rays have to be repeated, to see where you're standing and track all the progress. And of course, I'm sure when they come to see you and you do the lab work and you give them the supplements they need to take, you reassess it to see where they're standing, what needs to be changed or switched, right?
Yeah, absolutely. After a few months. So in my case, I have symptoms for where the person needs to feel all the symptoms that they have, like between 0, which I don't have it, into 5, I have it very severely. And after a few months, I send them the same form to see where they are now. And then based on that, I have this score that tells me, okay, what organs and systems I should take care of. So this is how I work, and I know that you do the same. So it's pretty fascinating. So it's great. Yeah, so do you have any like related stories that you want to share? I was very surprised about the woman who came to you right before she went to for labor. But any other stories that you want to share with
Well,
us?
one of the things that I see a lot of times, the young girls who want to get pregnant and they have a hard time getting pregnant, most commonly their menstruation is not regular. So usually by getting them under care and getting their menstruation regular and their hormone production normal, then they have a chance of getting pregnant. But years ago, I had a temporary employee that was there for a couple months, and I didn't really know that she was trying to conceive when she wasn't able to have a baby. But anybody who starts working for me, I immediately take him under the care. Whether they like it or not, they have to get.
For you?
so after, actually it was after she left, she came back and she said, like, I have to tell you, I am pregnant. And I never thought I would be pregnant because the doctor told me I can't.
Wow.
And my menstruation wasn't there to begin with, and I was having a hard time. But something happened after you got me on your care. I'm pregnant now. So honestly, I had no clue. And after that, I mean, oh, great. It's no doubt that if your body gets into her normal way that it has to be, anything is possible.
Yeah, it's like it's completely true, because when the body is blocked from something, whether there is a misalignment, and the energy, the energy of the body, the vitality of the body, the blood cannot flow. It's like we always think like energy is like I don't know, something like voodoo, but it's not. It's where the body vitality doesn't flow well, where the blood doesn't flow well, where when there's something stuck, where the microbiome is not in balance, where the hormones are out of balance. Yeah, I mean, the body will never lose energy for pregnancy
No,
because pregnancy requires a lot of energy from the body. So the body will store the energy. I say the same thing for women who are trying to lose weight. And I tell them it's nothing to do with your calories. It's nothing to do with the amount like of food that you eat or what you eat. It's about your sleep sometimes because the body stores the energy. The body needs the energy. And in fact, I know it's not related to the topic, but I have a client that she came to me and she said, I barely eat and I cannot lose weight. And I counted her calories, and that was less than 800 calories a day. And she was very active. She's doing tennis every day. She's very and she said, yeah, I have good energy, but I cannot lose weight. And in fact, in her case, I increased the amount of calories because she needed more calories. And then within 1 month, she started to lose weight so fast. And she said, I don't understand it. As much as I eat, I lose more weight. I said, yeah, because finally your body uses the energy and it doesn't store the energy. And it's the same thing with pregnancy. The body will not lose the energy for a pregnancy, which requires so much from the body, because if something is not aligned. So it's not surprising me
no.
that chiropractic can help that. That's amazing. And people really should know that.
Yeah, and honestly, it's not just women, it's men too. The
Mm.
fertility is something that is normal for the body to do. But if there is some blockage, that's what interferes with the fertility. I remember when I first started practicing, I had this patient who brought her grandfather, um, and she said he insisted to come in because he was telling me that for 11 years when he was married, they were trying and trying and they couldn't have kids. And it wasn't the wife's problem, it was him. The doctor said, well, it's not going to happen. So I don't know how he ended up going to see a chiropractor. And after one adjustment, he was able to conceive and had 2 kids. So as soon as he heard that I became a chiropractor because he knew my relatives, so he said, I have to come and see you because the chiropractor saved me. They helped me to have my kids.
Wow.
So it's not just women. Like you said, the energy could be blocked in anybody. If fertility doesn't happen, there is you could it's minimal to check to see where the blockage is, not just going through the normal medical round. I mean, medicine is always helpful, but sometimes you gotta tap into your innate energy and find out where the blockage is.
Yes. Wow. No, I know that this you talk and it makes me think like, yeah, fertility is a big deal, and we see more and more people dealing with fertility issues. And definitely, let's make the next episode about fertility. I think it's a big topic. So, any close comments that you want to end this episode? I know that this episode was amazing. I learned so much. Thank you.
Yeah, I learned so every time I talk to you, I learned a lot too. And I just want to make sure that people know that we are here and we are open to answer any of your questions. And we want to help as many people as we possibly could. So if you find some topics that are your interest, let us know and we explore that topic. And even if we are not expert in that topic, we could bring experts to talk about it. But our main idea here is to open your eyes to every possible way that you could help to be healthy for life. So if there is any topics you want us to cover, let us know. If there's any questions that we didn't answer and you want it answered, let us know. Make comments, subscribe to our podcast, let everybody know that we are here and we would be happy to help as much as possible.
Yeah, thank you. So, thank you, Dr. Gita. So, guys, if you find this episode helpful, don't forget to subscribe. Also, leave us a review. It's very meaningful for us, and share it share it with anyone who might be benefit this. And remember, your body is designed to heal and function properly. So if your body doesn't is not in balance, whether if it's a nervous system, whether it's your digestion, whether it's your sleep, whether it's your spine, just don't wait for things to happen. Do something about it. So until next time, stay well, be curious, and keep taking care of yourself. Thank you very much.
Thank you.